We have two main goals in our residency program. One, we want well-rounded, confident, competent pediatric dentists in the best practices of our profession. Our second goal of our program is we want our residents to be lifelong learners and advocates. We want them to go into our communities and take care of our most vulnerable patients.
One thing that really stood out to me was how approachable the faculty and staff are, whether that's discussing a challenging case or asking about career advice or input on research. They're always willing to be there and make us feel supported. Resident-wise, we work very well together in high-stress environments, but we're always there to check in on one another and make sure that we're doing okay. Because we do have hard days, and if we're there for one another, it does make those days seem more manageable.
The opportunity to be affiliated with Oklahoma Children's Hospital is really special. We're the only children's hospital in the entire state of Oklahoma. And being a children's hospital, it's not the same as being a general hospital. We're very specifically focused on caring for the highest level, most vulnerable patients, pediatric patients in our state. So what that allows for our learners specifically is exposure to very medically complex and very vulnerable patients.
It's a level 1 trauma center, the only one in Oklahoma. It is also a tertiary care center. So I knew that the kids I would be serving would have very specialized care and needs, and we'd be working a lot with specialists to provide that care.
There's a multitude of opportunities for our residents to collaborate with other divisions and departments here in Children's Hospital. Our residents spend time on anesthesia rotation. They do a rotation through pediatrics. They also do an endocrinology rotation.
We have around 10 part-time faculty that are all private practice, some of the biggest private practices in the city. They offer a vast knowledge, and then the existing faculty that's full-time here has over 100 years of experience, and so there's a vast knowledge of clinical experience. So from that aspect, you're going to be very well-rounded from a medicine standpoint. I would say getting out of this program, you are going to learn more about medicine than almost any other program in the country.
We have a formal mentorship as well as an organic mentorship. Structurally, formally, we are assigned to a mentor who we meet with regularly, where we do go over our progress with academics and clinical. But organically, we are with these same people day in and day out, so we're able to ask for their advice and their input on a daily basis and get their feedback. They look at us as future colleagues and not students, and so they value our input just as much as we value their input.
We also have opportunities to go into to some of our regional and national meetings where we can learn from the best in our profession. Through these experiences, we're really able to allow our residents to gain these essential experiences to be well-rounded and to serve our patients well.
Because we are a brand new facility, I feel like we're blessed to have some of the latest and the greatest technologies. On a daily basis, I am using things like the intraosseous SOAN injector. We also have things like a CO2 laser and a digital scanner. I think there was a lot of thought and emphasis in how the program should be run, what we should have in the facilities to have the best pediatric dental care in the state.
Because we collaborate on a health science center campus, we have a lot of research opportunities, but the really cool thing is all the resources that become available to them based on what they're interested in. So if they want to do laboratory testing, we have that at the dental college. If they want to reach out into the hospital and do something that has more to do with medical complexities, we have all the medical specialties nearby. And all of this is supported by biostatisticians and research experts here at the College of Allied Health. So we have everything accessible to create great outcomes for our research learners.
I'm new to Oklahoma. I moved in June for the program, and I've just kind of fallen in love with Oklahoma. Not only the pride to be a Sooner and all the games and things that go along with that, but just the outdoors, camping, being able to go to lakes, accessing all the parks and stuff with my family. And then one thing that's really been really nice and unexpected was kind of the food and all the food scene with the James Beard winners and all that stuff. So there's just a lot to offer in the state.
It's a really special learning environment, and then it's a really special place to be a provider for children. The kids that come here are the kids, like I said, that are in the greatest need of medical and dental care in our entire state. And to get to have the honor of providing that care and learning in that environment is not a typical opportunity for learners.